Well, I'm Dr. Nicholas Dodaro, board-certified emergency medicine physician, chief medical officer of Crucial Care, and medical director of the GuideWell facilities. GuideWell Emergency Medicine Doctors is a very unique model. I would love to say it's just like something else. There's nothing you really can compare it to, which has always been the challenge in explaining what it is. We're all familiar with emergency rooms in hospitals, which are kind of chaotic places dealing with very complex, sometimes life-threatening trauma sort of places. You have urgent care models in the market which deal with a little bit more simpler case and not necessarily the complexity or acuity. And then marrying up those two types of facilities is the GuideWell emergency medicine model. It has both the capabilities of high acuity, like you would see in an emergency department setting, and it's perfectly comfortable taking care of relatively minor or simpler aspects as you would see in an urgent care setting. And that range of capability is not something that has existed in healthcare in general up to this point. We pride ourselves on saying we've really created a model that's unique to the environment. What I love about the model is how accessible it is. Appointments are not needed. When you have something that bothers you now, you go now. It's 7 days a week. It's open on the holidays. The hours are quite a bit longer than you would see in a primary care office or those sorts of things. We are trained for the entire range of patients, from basically newborns to end of life. GuideWell is focused on not only the medicine, which we all learn how to do when we're in our training as emergency medicine doctors, but it's also care of the patient from start to finish and really making sure the patient experience is quality. The facility now allows us to rather specifically coordinate with primary care doctors, clinically integrated networks, those sorts of entities that have come about in the healthcare market where patients are trying to coordinate all of the pieces of their care. So we're able to coordinate on the front end and then on the back end. We are very comfortable and very proud of providing efficient care. It's more cost effective than your traditional emergency department setting. It's more time effective. And again, we coordinate the care on the front end and back end. So we're working with your specialists, your network, so that the total cost of care is far less than a lot of other settings that deliver highly complex, highly capable care. One of the things that we never forget at GuideWell is that being sick is scary. And there's a saying, when you're healthy, you have a million problems, and when you're sick, you have one problem. And we remember that, and that's part of the words we live by. And so we try and make the experience one such that the minute you hit the door, you know that we're going to take care of you, we're going to help you not worry, and we're going to make that experience a little less scary and frightening and complex than it would be in a lot of other settings. So the minute you hit the door, you're going to see that someone stands up to say, how are you doing, and what can we do for you today? And we're going to get you within minutes into your own private room. And that room's going to be comfortable, and that room's going to be clean, and that someone's going to be in to see you within just a few minutes to say, what's going on today and how can we help you? The physician's going to be in to talk to you, spend some time, look you in the eye, and really ask you a lot of questions. The care team is going to constantly check on you. So you're not going to be in a room for 90 minutes and not know what's going on. You're not going to be in a room alone. You're not going to know what the next step is. Our team is trained like what you'd see at a nice hotel to kind of say, here's the next step. My name is Jennifer, and I'm going to take you to CAT scan. Those sorts of things are the small pieces of a very complex puzzle that make you feel like we are paying attention to you the whole time you're there. And I think that's very different than a lot of care settings. And that focus drives what we do every day.